There are two very much important clinical conditions in which we can observe clot, thrombus in blood, venous thrombosis, and the arterial thrombosis. Venous thrombi can cause congestion and edema and painful and local painful condition. On the and the immobilization means detachment of thrombi from initial place can happen, and obstruction in the lungs has been observed in many cases, ultimately due to obstruction in lungs or acute chest pain, a death. If this condition persists for longer period, then it can ultimately lead to death. Then there is another important condition is arterial thrombi. Arterial thrombi is actually a major dangerous condition in case of obstruction in coronary artery and in the cerebral vessels, because in obstruction in coronary arteries can damage your heart or movement of heart, or in obstruction in cerebral vessels can cause hypoxic conditions for your brain, which can ultimately lead to death of the brain and then patient. What is venous thrombosis? Venous thrombosis actually of two types. Venous thrombosis, as you can think from name, is that venous thrombosis is actually a thrombus formation in the veins, and there is actually a two most important sites or veins are involved in the clot formation, like superficial thrombosis, superficial vein thrombosis, especially saphenous system, which is actually a network of superficial veins in our legs or in our extremities. So in saphenous system, there is a very huge chances of superficial thrombus formation. So in case of saphenous system, in case of thrombus formation in saphenous system in our legs, we can face painful condition, or painful local painful condition, along with congestion and swelling at a site. In case of superficial vein thrombosis, embolism is actually embolism chances of embolism is very low, but it can if a swelling or edema persists under the skin, it can cause infection in the in under the condition under the skin. uh, Another important condition is deep venous thrombosis. Deep venous, you can conclude from name that the deep veins, thrombus in the deep veins, actually it's the most common condition in the in patient in those people who are have who have more hypercoagulable states which have mutation in their genes. So actually those patients which have mutated genes or hypercoagulation, deep venous thrombosis is very much common phenomena with some environmental factors, like a patient with hypercoagulable state and with a long term bed rest, or with long flight, patient with low fat can develop thrombus in deep veins. So it's a more serious condition than superficial vein. Most sites are in popliteal, femoral, and iliac veins of the lower extremities are involved. More chances of embolization are involved, and after embolization, after embolus can obstruct in the lungs, which can cause acute chest pain. So after embolization or acute chest pain, if it remain unresolved, it can ultimately lead to death of the patient due to hypoxia, and edema can also occur. 50% of asymptomatic patients has 50% patients remain asymptomatic until clot immobilized or obstruct into the lungs. And after obstruction in the lungs, after facing with acute chest pain, clinicians identifies this deep venous thrombosis. A deep venous thrombosis in lower extremities can be due to congestive heart failure, long bed rest, immobilization, and slow venous return. In case of trauma, surgery, and burn, there is not only a deep venous thrombosis, just not only immobilization of the patient, but also due to vascular injury, increase in procoagulants, and increase hepatic synthesis of coagulation factors, and due to decrease tissue plasminogen activator. So, long-term bed rest and patient with trauma, surgery, or burn are more prone toward the deep venous thrombosis, in especially in lower extremities. Pregnancy related venous thrombosis is actually is a serious condition in during pregnancy, whenever uterus become large, amniotic fluid inside the uterus, it puts the pressure on the uterus, and the due to pressure on inferior at the back side of the uterus on the inferior vena cava, stasis of blood, chances of stasis of blood increase in the increases in the deep venous, increases in the veins. Then due to stasis of the blood, clotting formation can occur, and it's may due to increase, high clotting, increase in clotting factor. Another important condition is tumor-related thromboembolism. Tumor-related, many malignant tumors are involved in the formation of the thrombus in blood vessels. Due to malignancy. It's due to the dissemination of the fluid, dissemination of the tumor from one side to the another side. So, in case of many malignancies or many cancer, are may, are seen with increased procoagulant release, increased chances of embolus formation, and especially these chances are high in case of malignant cancers. So, cancers or malignancies are also involved, can cause disease. Here is another important condition is actually arterial cardiac thrombosis. Arterial and cardiac thrombosis are due to obstruction in the due to thrombus formation in the arteries, or in the chamber of the heart. So, it is also dangerous condition, because it can damage the pumping of heart, it can damage the functions of heart, it can cause injury to the heart, and due to obstruction in arteries, it can also be a dangerous condition. Another its important cause is atherosclerosis. An important condition in arterial thrombosis is atherosclerosis. In atherosclerosis, usually endothelial integrity become damaged, and due to damage blood vessels, or due to abnormal blood vessels, blood flow also become disturbed, and abnormal blood flow occurs. Due to abnormal blood flow, we have already studied that clot formation can occur in varicose striates. Cardiac mural thrombi actually and other occurs due to dyskinetic myocardial contraction. It means dyskinetic myocardial contraction disturbance is actually cardiac contraction can cause mural thrombi or cardiac thrombi. Then in endocardial injury, it can also cause endocardial injury. It's an internal layer of heart is actually endocardium, so it can cause endocardial injury. Another important condition is actually rheumatic heart disease. Rheumatic heart disease actually is also related with the cardiac mural thrombi. So mural thrombi is actually more prone towards embolism due to pressure or through high pressure from the heart or other conditions. So actually cardiac and mural thrombi and the arterial thrombi are also very dangerous for the body. So most another important change is D.I.C, disseminated intravascular coagulation. Actually, disseminated intravascular coagulation phenomena is can be seen in many diseases. It's actually a widespread clot formation in the blood vessels. It means in whole body clot formation starting occur. So clot formation in whole body veins or arteries in blood vessels is actually known as disseminated intravascular coagulation. It is linked with many diseases, malignancies, or many obstructive complications, and it is also linked with the many malignancies, platelet and the other coagulation factors. Other coagulation proteins or coagulation factors are mostly involved in the or disseminated clot formation in the body. On the other hand, due to disseminated clot formation, fibrinolytic pathways become activated. So, in case of widespread or in case of D.I.C, disseminated intravascular coagulation, we can observe excessive clotting and bleeding disorder in the patient. So patient with DIC is very much very difficult to save the patient in in DIC. So DIC can ultimately lead to death due to excessive clot formation in the whole body of the patient. So DIC linked with many DIC occurs due to many diseases, many causes, or many occurs, or it can. So here, this is all about thrombosis. We will move for embolism, another important topic from our next lecture, inshallah. Take care.